The functional relationship between the hip joints and back region. Under normal conditions, when sitting cross-legged, there is slight anterior pelvic tilt and the lower back is in a neutral position. Restriction in lateral rotation of the hip joints will cause lifting of the knees. 1. Restriction in the thigh. 2. Lifting of the knees will cause posterior pelvic tilt. 3. Posterior pelvic tilt will cause a flexed position of the lumbar vertebrae that will be expressed in flattening of the lumbar lordosis. 4. Flattening of the lordosis. Posterior pelvic tilt will cause a flexed position of the lumbar vertebrae that will be expressed in flattening of the lumbar lordosis. 5. Kyphotic position. 6. Restricted respiration. The rounded position of the vertebral column tends to cause the center of gravity of the body to deviate backwards. In order to prevent backwards collapse, the trainee is required to activate the hip flexors and the abdominal muscles. The bent forward position along the entire vertebral column causes compressive pressure on the lumbar vertebrae and symptoms of pain in the lower back following prolonged exercising. In conclusion, under conditions of prolonged sitting in which the trainee is unable to maintain slight anterior pelvic tilt, continuous pressure is exerted